How are you explaining public health to your family and friends? Do they understand the work that you do? Let's talk about it. You're listening to the PHEC podcast, episode 425. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. We are bringing you another engaging conversation in our series that focuses on providing plain language responses to the question, what is public health? I'm excited to share this conversation with you and continue this series. Now, if you are wondering what I'm referring to, the episode right before this one is where we kicked off the series. So make sure that you go back and listen to that if you haven't heard it already. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to the community partners, as well as the broader communities that they serve. The support that we provide often falls into categories of strategic planning, but sometimes it's also capacity building. Please reach out to us through our website, drchuntley.com. We would be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes as well. Now, today we continue with our dynamic series designed to answer one simple but very important question. What is public health? We're starting this series because public health is under attack. It's misunderstood, it's undervalued, and underfunded. I really believe that if more people understood public health, perhaps they would see the value, be able to embrace easily the value and protect it and invest in it. So we want to be a part of the solution by helping people better understand public health in a very relatable and conversational way. This is a response to what I've heard over the last several months from professionals across multiple industries who are trying to advocate for keeping public health and fighting for our programs and our agencies. They want our stories. They need better understanding to arm them for the good fight. So this is a part of the solution by helping to provide better narrative and understanding. It's something new in the series. We're approaching it with a lot of energy and enthusiasm. In this series, our featured guests are inspiring leaders who will explain their focus areas in public health through compelling storytelling and plain language, with the goal of reducing and ultimately eliminating the heavy scientific jargon. This is a work in progress, so we're just getting started. A lot of us understand that we need to discuss and explain public health in more plain language terms. We try to, and we don't always hit the mark or land very well, but I think practice makes perfect. So this is something that we're bringing to this series to inspire you to, improve your conversation around how you explain public health. Imagine what would happen if all of us who work in public health, and think about all of our individual circles of influence, our family members and our friends, if all of our family and friends understood public health and understood our role in public health, imagine how much further along we could be. So this is a part of a solution. So to kick off the series, our first guest joined us in the previous episode to explain and discuss public health, and we had a great conversation. Again, if you missed that, make sure that you go back and listen to that episode. My guest today continues in that fashion, and she joins me to explain public health and answer the question, what is public health? So let me introduce her, and then I'll connect our conversation. Visha Patel began her career as a registered nurse, specializing in oncology at Johns Hopkins Hospital, where the connections she made with patients fueled her passion. This experience inspired her to pursue public health, where she now works to inspire entire communities facing the same health issues. Currently, an MHS candidate in epidemiology at the Johns Hopkins Bloomberg School of Public Health. Visha specializes in cancer research, including groundbreaking work on how social determinants of health are associated with late-stage cancer diagnoses. Driven by a profound commitment to community well-being, she is also dedicated to mentorship, having helped develop a peer coaching program and working to enhance accessibility through student disability services. In our conversation, she shares her interpretation of what public health is in a way that anyone can understand, a skill she perfected by first explaining her career path to her own family. Let's connect my conversation with Visha right now. Visha Patel, welcome to the podcast. How are you today?
I'm good. How are you, Dr. Huntley?
I'm doing well. We were chatting for a little while before hitting record, so I'm really excited to have you join me and be a part of kicking off this new series that we're having for a deep dive on what is public health. So I kind of shared with you my passion and reason for hosting this series, and I'm really excited for kicking this off and hopefully watching the momentum grow. And we've got a lineup of folks that are going to be joining us as well. So let's just start from your presentation. I'd love for you to share your presentation that you have, and then we're going to spend a little bit of time just kind of diving in a little bit deeper into some of the things and aspects that you discuss. Does that sound okay?
Sounds perfect.
All right. Well, I'm going to just hang out here. I'm going to mute myself and hand over the stage to you and just take over whenever you're ready.
Okay. Thank you so much. So, hello, everyone. My name is Visha, and let's begin with what is public health. Before we dive deeper into what is public health, let's take a step back and understand what health is. So, as World Health Organization beautifully states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now let's understand what public health is. In my personal opinion, public health is a significant area that focuses on improving, maintaining, and protecting the general population's health in various communities from disease. This is done via surveillance or collecting data, performing research using those data, finding solutions via the research done, and last but not the least, implementing those solutions through policy development and advocacy. The primary goal of public health is to maintain a healthy community, irrespective of socioeconomic status or background. Thank you, Dr. Huntley.
Thank you, Visha. Right away, I love how you step back to explain what health is. I often do that in my workshop presentations. I think that that's a great place to start that levels the playing field, so to speak. We don't make assumptions about what people understand health to be, but we really address it right away. So I really applaud you for starting right there and doing that. I will bet you that would be a conversation to have with people for a while just on that definition of health.
I agree. I think it is important for us to step back and understand what health is before we actually understand what public health is and what we are actually doing as public health workers.
Is there a particular niche area of public health or maybe a population of people that you focus on or you're most passionate about? If you had to pick one that rises to the top, is near and dear to your heart, means something to you, like what would that population be or niche area be?
That's a wonderful question because that will allow me to share my background a little bit. So let me start with my background first. So I am a registered nurse by background. And then when I was applying for jobs, I applied to many jobs, but I think the instant connection I made was with cancer. So because of some of my family history as well in cancer, I ended up becoming an oncology registered nurse at Johns Hopkins Hospital. I practiced there for a year. The connections you make with the patients, the difference you make in their life, and when you see that difference, it means a lot. And especially with rising cases of cancer, I've just grown more affection towards that field. And after working as a nurse, I ended up pursuing public health because that is when I realized that I don't want to just make a difference to one person's life, but I want to be helpful to the whole population or multiple communities who are facing the same issue. And now I'm currently pursuing research in cancer. So my focus area is cancer epidemiology.
See that? I love your story. Thank you for sharing that. Thank you for the work that you've done. And that is, your experience from healthcare will absolutely carry over into public health and have such a greater impact. Take it from someone who's also had that same. I have a healthcare background, and every bit of that really it's a special filter, a special part of the filter of the work I do in public health. When you're able to connect your own personal story to a population, a certain area, like even as you're describing it, like your face is lighting up, does that come up in your conversations with people as you explain public health?
Absolutely. I take a pride in talking about my career and the path I've chosen. I love to talk about the differences that public health as a field collectively is making to this world. And I love that. I love every time I discuss. I love every time I speak.
Tell me a little bit about some of your experiences speaking, because I know that this is what we need more of, because we really want people to understand public health, and we can't just contain it to a box and a simple analogy and they get it, from one perspective. Public health is very broad and it intersects multiple industries, and it's just all about intersectionality. So when we can share our own story and our own perspective, that becomes another light, another opportunity for people to understand. So I know that as we're looking to help raise value in public health, when people really start to understand this whole system that works in the background, how can you, or how have you been able to do that, sharing your story? And like, what is some of the feedback you've received from people that are now understanding because of how you shared your story? Like, tell me a little bit more about some of that.
So when I first chose that I want to pursue epidemiology, and I don't know, this might sound funny, but the first person I had to explain why I have chosen this field or what this means was my own family, my own parents, because they have heard about public health, but they might not have heard about different niche or areas that public health has. So I had to make them understand what epidemiology is, what public health is, how it contains so many different areas. So as a public health personnel, you can do research, you can implement a policy, you can be a part of social work. You can work with the community to maintain and improve their health. There are just so many things you can do. You are not just confined to a chair working on a computer. No, you are actually going in the field, talking to people, connecting with them, and making those small differences. This is what public health means. You are working and serving for the communities.
So is that how you explained it to your parents?
Absolutely.
So they were on board.
Oh, yes. I mean, of course, they had their questions like, what is the research about? Because if we think about research, we think that, oh, you are in the lab working with some instruments and all that.
Mhm.
And I'm like, well, it's not true. That is just one stigma which people has created. Research is more than working in lab. Research is when you are actually going, talking to people, trying to find problems and trying to find solutions for those problems.
That's really great. And I think because I've interviewed so many people on this podcast over the years, this is a very common thing. It's, as someone who also specializes in epidemiology, it's difficult to try to explain it to family. And sometimes it's like, for a long time, honestly, I just didn't even try because it was just too hard. So I just gave some watered down explanation. But that's a disservice that I do to the industry, to my family. And it's something I don't want to encourage anyone to do. I mean, in the times that we're living now, we need to be doing whatever we can do to make sure that people understand what we do, what public health is, our role in it, because they know us. So maybe if they can connect to what we do and what public health is as it relates to what we do or with us, that's a starting point. And then their eyes or minds are set to then learn about public health in a different, if they learn it, for example, from an epidemiology standpoint, and maybe it's infectious disease or chronic disease, then maybe they'll be open to learning how it spills into environmental public health or maybe environmental epidemiology and then, more broadly. But it's like we can start with explaining it in the context of our own examples, our own personal stories. And when it's family, they already invested in us. So they care about us. So they're going to want to understand what we do. So that's an opportunity. And I find that they're the best ones to stow that energy into and making sure that they understand it. It doesn't always come in one conversation. Sometimes it's multiple conversations.
Absolutely. I agree. And I had to really explain them epidemiology in plain language. And if you don't mind, I would like to explain and share it with our audience as well.
Absolutely.
So epidemiology is, in a simple, plain language, a study of disease, specifically like occurrence and distribution among certain population, among those communities. And we, as an epidemiologist, we study that. How is it occurring? Why is it occurring? Why it is confined to certain population? And that is a large part of work we do, understanding the disease among those communities or population and how we can prevent it.
That's really great because then you can even go, because I've done something similar too, because you give them an example of the population. So if it is your family, you use your family dynamic as that example. If you need to give a disease example, choose a disease that's impacted your family, like you mentioned, oncology because of cancer and family members, then you can use that example because that your family members are it's gonna resonate. I often use diabetes because we had so many family members with diabetes on mom's side of the family. So I think that what you're saying, I love that plain language, that opens doors because then you can, and if it's a different community you're speaking to, you can insert whatever that community is. If it's women's health or children or, whatever the case may be, but start there and make it personal and relatable, that they get. It's just make it about them, whoever it is that you're speaking to. I think that's a great approach.
Thank you for saying that. But yeah, over the years, I have realized before I actually started diving deeper, I did not know much about public health epidemiology myself. So I had to obviously dive deeper. And we don't expect everyone to know about it. And that is what we are doing here. So people can understand in the best way possible. And that brings me that I would love to highlight some of the historical work that public health has done in the past, if you don't mind.
Oh, please.
So I think some of the key works public health has done, one of the big one is eradication of smallpox.
Yeah.
I know it was in the past, but that importance of eradication of such a bad disease is incredible. And then providing vaccinations. The most recent event that I would like to shed some light on is COVID. Half of our public health workers, I appreciate all the healthcare worker, what they have done, but also there were a few people backstage, and those were the public health workers who actually make sure they monitor how the disease is spreading, where it is spreading, who are the people who are getting most exposed and how we can treat them, how we can make sure that everyone is receiving the vaccination. So all those contributions, they might be backstage, but those are equally as important as what other people are doing. And this is the right time that we should bring them to the limelight. That is what I think.
These are great examples. And we have so many in public health. I think when we are able to have conversations where we can speak to our family members, our friends, and explain and insert the population. And then we can give these examples of these big public health wins or these relatable examples for our family members to then also position them to share back with us. Because you'll have family members, your older family members that will remember smallpox and getting
exactly. Yep.
And then you have family members that will have so many different stories to tell you about their experiences during COVID. And so that's a great way to highlight the roles of public health in these wins for these people who have these personal experiences with, these examples. All a part of helping people to, make this conversational, relatable, using plain language and terms. And then people are understanding the value of public health in these roles. And it goes a long way with how people perceive and understand. And it's not as easy to cut out programs related to public health when people are really understanding, like, oh, wait a minute. No, we need this. That's the whole point. That's the goal.
Absolutely. That is the goal for people, that there might be a setback, and there has always been a setback. That's how life works. But that setback is for us to grow and do better.
Yeah. Well, I'm really appreciative of this conversation, of what you do to really help explain public health to people around you, with family, friends, the work that you've done. And I'm excited about how you're going to bring that experience as a nurse in healthcare, specifically in oncology, into your public health work, and how we're all going to be able to reap the rewards, and you're going to be a contributing factor to the growth of public health. I really appreciate your dedication to public health in such a time when it feels super challenging. Thank you for taking time to share with us on this episode. I really appreciate it.
Thank you for your kind words. I couldn't resist but be part of this exciting conversation. I'm so happy that I could share my story and help people understand what public health is with what as little as I know. If that makes a difference, I would be more than happy to share. So thank you so much, Dr. Huntley, for your time and allowing me and providing me for this platform to convey my story.
Well, you are very welcome, Visha. I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Visha and learn more about the incredible work that she's doing. When you reach out, be sure to let her know that you heard her episode on this podcast. You'll find the links to connect with Visha on the show notes page. And the show notes page for this episode, which is 425, can be found at phecpodcast.com. And once you're there, just navigate to episode 425 to find its show notes. One more thing before we go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals from around the world. You can download our new PHEC podcast community app in Apple or Google Play Store. You can also find the link in the show notes page for this episode. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.